Great. So thank you everyone for joining our webinar today. Our webinar, Recruit Your Study Participants on ReachBC, will be a chance for you to learn more about ReachBC, and it's hosted by myself. I'm Steph Chia, the manager for ReachBC, and I'll be doing this webinar along with my colleague, Aisling Quigley, who is our ReachBC Marketing and Communication Specialist. ReachBC is part of the Clinical Trials BC unit of the Health Research BC organization. So we're really excited to share a lot of things with you today. Hopefully by the end of it, you'll learn about what we do and how we can help you with your research recruitment needs. And just so you know, we will be doing our tablet draw at the end of our webinar. So you do have to be here to claim your prize. So please stick around if you can, and we'll be doing the draw at the end. So before we start with our webinar content, I would like to do a land acknowledgement, and I am currently in Richmond, BC, and our offices are in Vancouver. I acknowledge that my workplace is located within the ancestral, traditional, and unceded territory of the Coast Salish people, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So what you're going to learn today is that we are going to give you an overview of what is ReachBC and why was it created, as well as tell you a little bit about the ReachBC directory and how you can use ReachBC to recruit study participants and patient partners. And then how can you let, I was just checking if people can hear me. Is there a problem with the audio?
I can hear you okay, Steph. It seems to be working. Yeah.
Okay, great. Okay, sorry for those who can't hear me. It's just sorry for the pause. So, yeah, and we're going to ask, how can you let others know about ReachBC? So if you do have any questions about ReachBC and specifically, there's a Zoom Q&A section at the bottom of your Zoom screen. So please put them in there and then we can track how we answer those questions. Okay, so next. What is ReachBC? So it is an online platform that's designed to help British Columbians find and connect to health research opportunities. So if you can imagine Craigslist, where there's a listing, online listing of all these health research opportunities, but combined with like a dating app where we can actually match people based on their preferences and their profile to these health research projects, you'll get ReachBC. And it was developed over several years of planning and engagement with the public. We talked to health researchers in the province, a lot of our key stakeholders and the public. We traveled around the province to actually hear through community dialogues what the public wanted to know about how to find health research projects and how to get connected to them. And we came up with ReachBC, which you can find at reachbc.ca. And the main purpose of ReachBC was we really want to raise awareness of health research in the province and assist researchers with your recruitment needs to find study participants, find patient partners. We know you researchers are quite busy trying to recruit participants in all different types of ways, like posting these posters on bulletin boards or putting ads on Craigslist or newspapers, on the radio. And we really developed ReachBC as kind of another recruitment tool you can use and hopefully make things easier for you to find the people that you're looking for. With our overall goal to have one place and one central place that people in the province can go to find health research projects and hopefully have more people participating in health research because of it. So why did we think we needed something like ReachBC? Well, there's actually some evidence to kind of really show the public has an interest in learning about health research. A public opinion poll done in 2015 asked people whether they knew where to find current research opportunities, and only 15% of the survey respondents knew about how to find health research opportunities. But when they were asked whether they'd be interested in participating in health research, 70% of them said that they would be interested. So we feel like if we can get more people to know about health research, there is an interest there that if we can just give them an easy place for them to go and find those research projects, that they'll be more likely to participate in research. And another survey that was done about, a Canadian survey about participation in clinical trials also showed similar results, like people viewed clinical trials that they would provide societal, and personal benefits to participate in trials, and that they would be somewhat to very willing to participate in a clinical trial. So ReachBC is hopefully going to close this gap of like people not knowing where to find these research opportunities. If more people know about them, then we'll have more people getting connected to health researchers and more people participating in the opportunities. So I've talked about clinical trials, clinical studies. We also share health, behavioral health research studies on ReachBC. We also, but not only those health research studies that we share, we'll share an opportunity called the Patient Partner Research Opportunity. These are opportunities where researchers are looking for patient partners if they want to do patient-oriented research. And if you're not sure what patient-oriented research is, it's research that's done in partnership with patients. We use patients as like a loose term. It can mean individuals with personal experience of a health issue, including their informal caregivers like family and friends. And it's really about answering research questions that matter to patients and with the overall aim to improve healthcare. If you want to learn more about patient-oriented research and how you would engage with patient partners, you can check out the BC Support Unit, which is one of the units of Health Research BC, for a lot of resources on how to engage with patient partners. And if you are doing clinical trials as an investigator, this is something important for you to know also, is there's been recent changes to guidelines where clinical trials need to involve patients in getting patient input into the overall, all aspects of a clinical trial, from planning, design, dissemination of results. So you will be needing to engage these patients in your research projects. If you have questions about that clinical trial, the new guideline for clinical trials, you can go to Clinical Trials BC for some resources about that. And when you are ready to engage patient partners to do your research, you can come and share your opportunity on ReachBC, and we'll help you connect to those patient partners. Okay, so we're going to take a brief poll now to learn more about who is attending our webinar today. I have two questions for you, and I'm going to launch the poll right now for you to fill in. Please only fill in this poll if it applies to you. So if the questions don't make sense in the role that you do, you don't need to complete it. And we are going to take these poll questions to learn more about you, and hopefully take it away to think about things that we can do to help improve ReachBC or provide some resources to help you as researchers. So I'm going to give you 30 more seconds before I close the poll. Okay, so if you're interested in the results of the poll, I'm sharing them now. Hopefully you can see those. It looks like a lot of people are interested in finding study participants, or both study participants and patient partners. And chart review is being the #1 way you would find study recruitment, study participants for your study. Great. So next, I will tell you a little bit about more details on how you would use ReachBC to support your recruitment. So it starts off with just simply creating a ReachBC researcher account. We ask that the principal investigator and any member of your research team that is involved with recruitment or contacting potential participants to create your researcher account. After you have your ReachBC researcher account and log in, you'll get access to our research study form that you can click on to submit information about your study, to create your study posting, and any eligibility criteria that we can use to help match you to any volunteers. Once you submit that research study information, our office will kind of just do a brief overview check that everything looks good. You're using lay-friendly language, that the criteria was selected properly, and then we'll ask you to submit that study posting information to your research ethics boards for review. As a recruitment, what you're using for recruitment. We have already done a lot of engagement with the research ethics boards through Research Ethics BC. So the REBs are well aware of what ReachBC does and how it works. And so the approval process to approve your ReachBC study posting is quite simple from the RAB side. Once you get approval, we'll just ask you for your certificate to show that you got that approval to use ReachBC. And then we will approve your study posting and it'll go live on our ReachBC directory. And once it is live and approved, our system will automatically find those match volunteers for your study. If you are looking for patient partners for patient partner opportunity, you do not need to do step 3 and 4 where ethics board is involved. So we'll do our own internal review and then we'll post it onto ReachBC, the directory. So the ReachBC directory is the online directory where people can come to find all the health research projects that are happening in the province that have been submitted to us. We've done a lot of work to this recently in a project that we worked on with the BC Support Unit. So I'd just like to acknowledge their support and thanks for that work that went into this. We added this new map component where you can now visualize and see pinpoints of where these opportunities are located. We're sharing a lot more information about the research team, the organizations that's involved in their research, whether the research project is patient-oriented or not. And one big thing is that previously we were only showing currently recruiting research projects, but now we have a past studies area. So once your project is completed recruitment, you can still have it shared on ReachBC directory. And we have an ability to share your results of your study on ReachBC. So there's going to be a demo part of a live demo of the ReachBC, and I'll go over this ReachBC directory in a little bit. But before I do that, I just want to quickly go through the steps that it takes someone to sign up as a patient or a member of the public to join ReachBC. If someone is interested in learning more about health research, they can just come to our site and sign up as a ReachBC volunteer. We've made it a super simple process. We ask for their contact information, their demographics like age, sex, gender, where they're located, and they can select the types of health research topics that they want to know about. And after based on that profile that they've created, we match them to the research projects we have in our database and share that with them. They have a chance to review some of the details of the eligibility criteria and choose whether they want to learn more about that project or study. And then we will facilitate the connection between that volunteer and the research team. So when they get matched to a research project, they see these details of a research study, and this is the type of information that they would see with the purpose and some of the eligibility requirements. But they also have these 2 buttons at the top that says, I'm interested, contact me, or I'm not interested, delete. So after learning more about that study, they can click on I'm interested, contact me if they want to get connected to the research team, and then we will connect them to the researcher who's doing this study. So now I am going to go to our demo. So I'm just going to take 1 second to pull up the site. Okay, so can everyone see Ashlyn, can you see the ReachBC site?
Yeah, I can see it perfect.
Great, awesome. I'm going to start with signing into my ReachBC researcher account so you can see what that dashboard looks like. For researchers, we do actually have a 2-factor authentication login required. This is a security measure that we did so that because you have access to some personal information on your dashboard. So I just got sent a 6-digit code to my cell phone and I'm entering that in here. And I'm logging into the researcher dashboard. So this is where you'll see any projects that you had previously submitted to us on your dashboard, and you'll see these 2. Yes.
Sorry for interrupting you. Is there any way you could zoom in a little bit? Someone just asked if we could make it like 150%. Oh,
that look good? Okay.
That looks great, yeah.
So you have 2 buttons here at the top of your researcher dashboard, and they give you access to the forms to submit the 2 types of opportunities, research study, patient partner opportunity, depending on who you're looking for. They are similar forms, but the research study is a lot more detailed. So I'm going to show you what that one looks like. So this is the add a research study form. The first thing we'll be asking you is to search for your principal investigator by email. That means that your principal investigator already had to have a ReachBC account. So if they do not, you'll have to wait for them to do that before you can enter their email here. We'll ask you some information like, is this a patient-oriented research project? If yes, well, you can choose to add some more information about who you're working with, and then add additional collaborators that might be on the project with you. If you are part of like maybe a larger study team and you have many coordinators that are working on recruitment and contacting people, you could add them here so they all have access to the same study and same contact list. They just need to have a researcher account already, ReachBC account. Information about any affiliations you might have, and then we'll ask you about your study details. So what is the title of your study, the lay study title, and then ask you to come up with a catchy short headline for your study that will be shown to the volunteers as a way for them to get attracted to your, to click on your study and learn more about it. If you're doing a clinical trial, you can share your NCT number here, and we'll actually link to the clinicaltrials.gov site. We'll ask you what is your estimated recruitment end date. So basically, how long do you want your ReachBC, how long do you want your study posting to be live on ReachBC looking for volunteers? And this will also serve as a reminder. Our system will email you a reminder saying that your recruitment end date is approaching. Are you finished recruiting? If yes, you can change your status to close recruitment, or you could extend it if you want to go longer on ReachBC. Then there's information about where your study is located. You can choose if it's an online project or if for the region in the province that your study is in. And study purpose, what's involved, what is the estimated commitment for your study, whether there's any procedures required, and are you reimbursement of expenses for the potential participants, and then details about your eligibility criteria. So these are really important for how we will match people to your study. So you can enter in a minimum and maximum age requirement. We do have both years and months available. So if you're doing pediatric research, you can select months, whether you're accepting healthy controls or not. We have sex and gender eligibility, and then you can add any additional inclusion exclusion criteria you might have. So these are age, sex, gender, location, as well as the health research categories is how we match people to from the volunteers to the research projects. So this is our full list of the parent categories of our health topics. So you can click on each one and kind of see all these subcategories we have. And you would categorize your research project as to where it would fall under these categories. You can select more than one where it might apply. And this is the volunteer has the same menu. They would be selecting what they're interested in learning about. And that's how we can get better matching for finding someone who might fit your project. So the last section is just study contact, who would be the contact person shown on the study posting. And you can enter your ethics certificate information there. And that's once you submit submit it for review, it'll come to our office and we'll take a look at it and tell you the next steps. So I'm going to now show you what it looks like once the study has been approved with information filled in. I just want to note that this is copied from a research study, but this is not, this is on our demonstration site with some also fake information about the contact information. So this is what the full approved study details look like and this is exactly what a volunteer would see that matched your project when they logged in to look at it. Except the difference is they have buttons at the top that says, I'm interested, contact me, or I'm not interested, delete this study from their dashboard. And if they clicked, I'm interested, contact me, you will find them on a tab here called Manage Volunteers. So when you click here, you get a handy list of everyone who was in a volunteer in our database. That first they had to have matched your eligibility criteria, and they read through your details and clicked, I'm interested, contact me. And we're providing you with these contacts of these people who are interested in your study, to participate in your study. You have choice to contact them by email or phone. And we have this follow-up status here to let you know, for you to let us know whether you are successful in enrolling them into your study. So once you've contacted these potential participants, please come back or please update the status to say whether they have been enrolled in your study or whether they were not enrolled, and what was the reason why they were not enrolled. These would be really helpful for us to figure out how well ReachBC is doing in helping your recruitment, and ways that we can help improve in the future. So the last tab here on this research study site is the results. This is where you'll have access to a form that you can share the results of your study. So once you're done recruitment, you've started doing your study, you could even share interim results here, letting us know that these are interim results so far, what you've found from your study, any study limitations you might have had. And we give you the chance to share a link. You could link to an article that you published, or even to download a file of maybe you developed an infographic or a postcard thing that you'd like to say share with the public. And this will all this results section will appear on our ReachBC directory. So I'm going to show you what it looks like on the directory now, and I'm going to change tabs here to this is our live ReachBC site, so reachbc.ca. To get to our ReachBC directory, you can click on this Find Studies tab here, and we have a few quick links for people to search if they were interested in COVID studies. It's kind of like just a shortcut button they can click. If they're interested in learning about patient-oriented studies, they can click that or see everything. And then we have a search bar where they can just type in any health condition or topic. I'm going to type in mental health so you can see what happens. So we've got 36 results coming back for mental health, and you can see where they're located on the map. So again, you can use the map to zoom in on specific areas to find a project, or you can navigate on the left side from these are results that returned. This is currently showing everything that's currently open for recruitment. But you can also toggle to any closed projects that are now recruitment closed, or they're completed projects. And for filters, this is where someone could come and narrow down their search to search by opportunity type, what their age is, where they're interested in the location, and research team information. So someone from anyone who's interested can come and look what studies are in Vancouver Coastal Health, Vancouver Island Health, what studies are at different universities here, like University of Victoria, or organization, and also researcher names. So if you told a patient in a clinic, like, oh, look for me, if you didn't have time to recruit the first study, but they know your name, they can search for your name and see all the projects that you're associated with through the directory. And I'm going to update the search here. So I've got 17 results from University of Victoria, and I'm just going to scroll down so that I can show you this project here has results available. So I can click to learn more about this project, and I'm presented with a summary of what this project is about. I can see who the principal investigator is, but I don't see study contact information until I join as a ReachBC volunteer, or if I already am a ReachBC volunteer, it'll show up on my dashboard. And then here's the project results that get shown to the public here. This project results piece is new, and we strongly encourage researchers to complete this once you have some research findings. We know that it's really important for participants to know what was the outcome of their participation. So I'm going to switch back to my PowerPoint slides now, just to kind of talk a little bit more about that. This is really, why should you share your study results? It's a chance for you to share your knowledge translation tools and products you developed. It improves study participation satisfaction, and it meets national and international guidelines that are all about best practices on communicating those results to the public and participants. We actually worked with the Clinical Trials BC working group on communication of study results to develop that results form and what type of information should be shared. So if you want to see that, there's a toolkit about communicating study results. You can access it at Clinical Trials BC, but there was a survey that was done that actually, it just goes to show like the participants really want to know the results of their participation. If they were not received any results, they get a disappointing experience, and that can really impact maybe this one time they decide to join a project and they had a bad experience. They're not going to sign up again for a future research project. So this is why we're really just encouraging researchers to go back and do fill in your results of your study, as people want to know. Okay, so I'm going to take a break and do the next poll question. So we'd like to know what are your main recruitment issues? So I'm launching the poll now. And what are the most common reasons someone you contacted was not able to participate in your study? We have a lot of options there. I was not able to put a other option. So if you do want to share another issue or another reason that's not on the list, maybe you can put it in the chat with just saying what question number you're answering.
And Steph, while they're answering, maybe there was a question here. Who is funding Reach BC? Where does the operating money come from?
Sure. So as I mentioned, we are funded by the Health Research BC organization, but we did have lots of partner funding previously in the development of Reach BC, and I'll have an acknowledgement slide and I'll go through all of our partners at the end. Okay, I'll give you, I think maybe 30 more seconds to complete the poll. Okay, so most people are filling it in. All right, I'm closing the poll now. And here are the results. So main recruitment issue was, it's not right. Main recruitment issue, hard to reach my sample population. And the most common reason someone you contacted was not able to participate looks like too busy, commitment issues. Great, thank you for sharing that. So I am now going to tell you a little bit about how ReachBC is supporting COVID-19 research. We launched ReachBC in April 2020, so right at the beginning of the pandemic. We had been working on it for quite a while, and we had wanted it to be supportive of all types of health research, but at the beginning of the pandemic, we saw a need that we could help support any COVID researchers that were looking for any patients or potential study participants. So we went live in April, and we also at the same time partnered with the BC Centre for Disease Control to create a COVID-19 consent to contact registry. And that was meant working with public health and the different health authorities in order to contact all confirmed positive COVID-19 patients. Were called and asked if they would be willing to be contacted to hear about COVID-19 research. And right now, that database registry now has over 50,000 participants of these COVID patients. So it's a huge feat. A lot of people, a lot of effort went into getting those participants, contacting them, and we will be inviting them to join ReachBC or importing them into our ReachBC database. So if you're a researcher with a COVID-19 project, I highly recommend you could share that on ReachBC, because we will be having a huge pool of people, these COVID patients that could be matched to your project and hopefully help with your, you'll have an easy time with recruitment. Okay, so another poll, last poll from me, and before we switched to Aisling, is we want to know whether, based on what you've learned today so far, if you are likely to use ReachBC either for recruitment of study participants or for recruitment of patient partners.
We have another question here, Steph. I'm a grad student in the process of collecting participants, so I already have REB approval. Would I need to resubmit to REB in order to use ReachBC as a tool to recruit?
Yes, so it would be an amendment to your ethics approval. So the ethics usually wants to know all the different ways that you're recruiting. And so it would be a very minimal amendment, just saying that you're adding a recruitment tool to your recruitment methods, and they want to know what information will be going out to the public. So it would be a very simple amendment that they could approve quickly, I think. Okay, I'm going to end the poll now and share results. So it sounds like we have some interested people who would use ReachBC, so that's great. And that's the end of that poll for me. I'm going to now pass it over to Aisling to tell you a little bit about who we have right now in our database and some of the marketing activities that we have coming up.
Thanks, Steph. And there's a few more questions there you might be able to help with. Hi, everybody. I'm Aisling. So I work in the marketing and communications at ReachBC. So it's my job to try and make your life a little bit easier, and so that this partnership together works well. So how can I make your life easier? Well, I saw that you're looking for healthy controls, but the first thing I want to do is take you through who have we got on the platform at the minute, and then what is our plan to get more people using it? Because Steph has demonstrated its capabilities, and a lot of work has went into creating this to make it as user-friendly for researchers so that it works, and it's a provincial platform. So it's my job to try and get as many people to know about it and to use the platform. So as you'll see here, we launched in 2020. So at the minute, we have 3,700 volunteers who've created profiles on the ReachBC platform. So it's been a very slow, organic growth, and there hasn't really been any marketing or communications, and there was no one in my role up until July of last year. So right now, we are leaning more towards the younger demographic, but I don't feel this is an accurate portrayal of who the real audience of ReachBC will be. You'll also see by location we're skewed towards Lower Mainland, but we haven't had any real promotion of the site. So I will bring you through our marketing and communications plan, which is a provincial plan trying to get as many people across BC and the province to know about it. Go to the next slide, Steph. So you'll see on the right, this is the table for the top categories for the research projects on our site at the minute. And then in the little orange asterisks, this is these are the top volunteer selected categories. So people who have created accounts and decided, when Steph showed you the list of all the different health categories, these are the ones that were selected the most. On the left, we have a pie chart showing here the difference between the number of research studies and patient partner opportunities. And we really are hoping to grow our patient partner pie slice over the next year as well. So the pre-recruitment phase, I mentioned I joined Reach in July last year, and my main objective when I started with the company was to get the website and the messaging as clear and concise. So what is ReachBC? You know, what is a health research study? What is a patient partner opportunity? And it's really my job to tell that story to the public. So really to inspire and educate the public and all visitors to our site. And so we decided to do this by creating 4 new videos. And in these videos, we interviewed researchers and we interviewed participants. And really, it's like that personal real life story of like telling people why is it important to participate, because a lot of times people don't understand. So showcasing that we are a nonprofit, that it is safe, that you do have full control over your data, that you are helping back, those real altruistic important reasons of why you might want to volunteer your time to do something like this. And we had some really gorgeous participants, and we'd love to share the videos with you. We're going to share one here now, and Steph has it. So we did the 4. We did one on patient partner, we did one on a research volunteer health study, another on researchers, and then one about what is ReachBC. And just before we show you the researcher video, I think is the one we're going to select, and we're happy to share all the others as well. if I'm not too, yeah, I just want to just briefly touch on the sign-up form. So before we launch our marketing campaign, which is about to launch across the province, we wanted to make sure that our bounce rate wasn't too high. So in marketing lingo, essentially what that means is people were coming to Reach and they didn't understand what it was and they were just leaving straight away. So the idea is now we have these beautiful videos, we captivate them, and then they go to the sign up form. And the sign up form before, it was like a really lengthy process. It was taking a couple of minutes. We've condensed it to this like beautiful slick form you see here. It's like less than a minute to fill out. It's got like minimal entry, minimum like categories, and so the conversion rate will be higher. So the idea is if anybody expresses any sort of interest, that'll take them a minute, and then they signed up, have their account, and in there they can access all of the studies that they've clicked in health categories that they're interested in. So it's another aspect of our pre-recruitment phase that we've been working on in the background. I'll play that little video now, hopefully all going well.
Yeah, so I'm what is called a clinician scientist. Part of my work is what most people regard as real doctoring, or some people would say, so clinical work in the hospital. And then part of my work is doing research. And I would say to me, research really should be regarded as part of clinical care.
Through your clinical work, you know exactly where you need to conduct the research and how your patients are being served and what's lacking. ReachBC was wonderful, very easy to engage with, and very easy to integrate in our workflow, including the ethics approval process.
It's often really hard to kind of know where we can go to connect with people, to find those patients who are interested and excited about research. ReachBC allows us to instantly connect with people who have different kinds of experiences with the healthcare system. They may have different kinds of either mental or physical health conditions, and they're all excited about participating in research.
We tended to use the ReachBC website to try to get our patient partners, and we got quite a few hits within a few days. We were able to get a good number of people who were interested, and then we, contacted them and we told them a little bit more about the study and onboarded them. And yeah, we've got 3 great patient partners. There are lots of resources for participant engagement, including the ReachBC website, and we've got lots of different avenues, both for bringing people into the study as well as for disseminating our research.
It's a very effective way to help inform people, both patients and volunteers, about research opportunities. And I really love informing our previous study participants about our research results. It's very exciting to let them know kind of how their individual contribution helped us to achieve the answers that we were looking for.
We can't do anything without patients and the public helping with our research. And so ReachBC is really invaluable in helping us to connect with the public and helping us to connect with the community at large.
Any way that you can contact and find other engaged potential study participants is a huge, huge advantage.
So that video is for researchers, and the others are more specifically for volunteers and the public for them to understand what it is they would be getting involved in and how they can get involved and why they should. So now hopefully we're at a stage where we may have inspired and educated the public, and they see these videos of real life people telling their story on their screen, but we really need to drive traffic to the website. We need to let as many people as possible know about Reach, and also build awareness across the platform, across the province. So we're going to do this with our first phase. Our marketing strategy is divided into 3 for the first phase, and it's starting actually like next week. But it's a 3-part phase. So we're running a digital campaign, a publicity campaign, and an email marketing campaign. So for the digital campaign, we're looking at running a Google search and a Google AdWords campaign. And that's exactly what you would imagine. We buy Google AdWords, so we buy search terms and we pay for them, and if people are looking up health research opportunity in BC, and there's lots of different terms that they find Reach, and then they find our website, and then they can get all the information they need there. We're also looking at doing a YouTube campaign, so we'll be really promoting these videos, trying to get as many eyeballs as possible on there. And also anybody who watches the videos, then we'll be doing remarketing campaigns. So if you see an ad, or you click on an ad, or you see a video that we're remarketing. So we're showing them a Reach ad again and a little bit more information with the hope that they'll click through it the second or third time. We're doing a social media campaign across all channels. And the main, I guess the primary thing behind the social media campaign is email recruitment. So we're looking to do a Facebook lead campaign where we get people's email who are possibly interested, and then we can put them on an email journey. So just an educational journey explaining what we do, who we are, building that sense of trust, encouraging a volunteer sign up, and then maybe getting them to select categories and move forward from there. For the publicity part, Steph mentioned that we have this partnership with the CDC, and it's worked out really well, and it's something that we really want to talk about, and I think it's a really nice, like a lot of people might know about something like this. So we're going to use it as an opportunity to create a press release for the public going, look guys, we have all these fantastic COVID studies on our website. We also have 50,000 people who've said, yes, sign me up, I'm interested. Those 50,000 people who've said, I'm interested in a COVID study, are going to be sent this email from Reach, welcoming them to the platform, giving them a list, a matching email of all the COVID studies. So if you've got any, please do put them on there. And the hope is that when we send that email, also we can, let them know about all the different other health categories so that they become a participant in all, like lots of different ones as well as just COVID. The press release is, it's mainly a brand awareness piece. There's no direct benefit in terms of like members of the public can't access or become involved in the registry, but what they can do is come to the Reach website. So we get testimonials and quotes from people who've been involved in COVID studies or researchers. And it's just a really nice way of like getting more people to know about what it is that we're doing. We'll go to the next slide. So for this, okay, so we get more signups, more studies. I think it's like if we have 50,000 people on your site and then we do this digital campaign and try to reach those hard to reach. I saw a question come in, how are we reaching the hard to reach areas? And I'll just go off topic for a minute, but it is something that we are exploring. It's in our phase 2. We have a couple of different strategies. We're looking mainly at like collaborations and partnerships in those harder to reach areas and what we can do there. We have some really, really fun ideas. This is our first phase, so this will be the next 3 months and then we'll be doing that. But we do understand that the benefit of Reach and a platform is this, is that we have people from all across BC, and we do want it to be one of those platforms and to have a more equal, broader demographic so that it is useful, so that when people come on that we can fill the studies with the right candidates and that we have the studies. So it's like we need both. We need the studies and we need the people. So we're working on both, but we're open to ideas. And this is a really good example of the consent to contact list. It can be hard, I guess, if you're in your own workplace and institute and you have your own consent to contact list and maybe that's not something you share. But I think the beauty of Reach is that it's like a central platform. So it's somewhere we are happy to work with you guys in like importing these lists, and these people are in there. And it works in many good ways because you're giving the participant or the volunteer a full access and control over their data. So they get to decide what they're interested in, what they're not interested in. And then and only then can the researcher contact them. And it saves researchers so much time. And also you're getting this pool of people that you can all access, not just your own list. So we are open to working with consent to contact lists and how we can enable that. The second thing we can offer is provide print materials to distribute in your place of work. So if that is something, we did speak with someone who's works in pediatrics, and she said, look, it would be great if you had brochures or flyers educating like how parents can get their kids involved. And it is something that we are exploring in our next phase as well. How can we get more parents on there? How can we talk to children? It's a totally different strategy, but something we can do. We came up with some fun ideas, but we're open to those type of conversations as well. We do have some brochures and postcards and posters and things that we can provide if somebody is at your reception desk and interested. The posters with QR codes, myself and Steph, when we were recording the videos, we were in a lot of research labs and we noticed like there's so many posters. And I guess maybe not everybody knows about Reach. And I just thought, well, it might be nice if we could place some Reach BC, really simple, like recruit your study participants here with a QR code that links you directly to a page of like how to do it. If there's people or staff members, maybe it would work better with, learn about health research studies. And we host the poster in your reception, and then somebody comes in and they're like, oh, you're interested in health research. There's a QR code. It gives you all the information. It links to the videos. The Reach BC breakfast morning, I know it feels like we've been experiencing COVID forever, but if we ever do get to return to normality, I think it would be really gorgeous if we could come in and have, a breakfast like meet and greet, and we just talk about this is how it actually works. And this is this is what you say to people who are interested in. This is how a volunteer creates a profile, and here's some marketing materials to help. Or even like, what is it that you need us to do? How can we improve this? The publicity press release. Okay, so maybe you're working on a study and you're thinking, I'm not getting the right candidates for this, or how can I reach these areas? Or this is really unusual, I have these really different findings. Like, I'm happy to work with you in helping a partnership to promote the study, promote Reach, if we can find a good media hook to do it, because there's always days where there's like slow news, or maybe you've got something really exciting. But it's mutually beneficial, and it's also good to let more people know about what it is that we're trying to do here. Partnerships and collaborations. I put this in because, like that conversation we had around pediatrics, there's usually lots of interesting things that come up that we might necessarily discuss here that we are open to talking about. And actually on the next slide, there was this concept that Reach was looking at doing before COVID, was like the registration site. So we had this all ready to roll out, and we're looking at doing it this year. So what it would be is myself and staff would come in, and we would, have a meeting, educate everybody on like front reception or at these sites, who would be, I guess, the people who are interested in health research ask questions to. And we would just show them how Reach works, show them what a volunteer needs to do, sign up, provide them with the tablet, which these tablets are from, and they just input their information there and then, they get their account, and it's all done. So if that's something that you're interested in, we'd love to chat as well. If you're trying to like simplify the process, you're also giving your own unique code. So if you want to access, who signed up through my clinic, that we can see, and we can show you who signed up from there as well. So together we can help each other, because this is not going to work unless we do it all together. And we were trying to think, there's so many elements, I think, to the success of something like this. We need like the patient element, we need the healthy controls, we need the rural people, we need lots of different things, and we're going to slowly over time get there, and we're in a really good starting place, but we've got a lot of work to do. But I think together we can really grow this and make this platform work, because we have funding for 2 more years, and we want to prove that it works, and it works well. So I have created this Reach digital toolkit. So in the toolkit, what you're going to get is, you're going to get a digital flyer. So it's exactly what you imagine. It's like a 4-page or a 3-page brochure that you can send to somebody digitally, or print, or we can provide. You're going to get some postcards. You're going to get, we might put QRs in them, a frequently asked question section. So that's just going to be all the questions you can imagine, which is also on our website. An email signature, and we found this works quite well. So if you want to like tag this on, it can link directly to the website and tell people more what it is on your own work email that you're sending out. And then we have about 7 slides that we're going to send on what is Reach BC and how can you recruit, that you could use in your presentations or share, or something that might be useful to you. As well as that, we do have suggested scripts for emails and for phone conversations. So when a participant comes along and they say, I'm interested on the Reach BC platform, we want to make sure that we really nurture that relationship, and that first experience is a positive experience. And I think it depends who's contacting them, but the fact that they've expressed interest, you've already got that like open door. And we did have a couple of slides on like research that's been done behind the success of this, and like key points and things to say, how to communicate. And that's something that we are going to provide, and maybe we'll do it again in a different presentation, or we'll figure out a way to share it with you. But I think it's really important. So we do provide that as well, just to make it as streamlined and easy as possible for you guys. So I have a little poll question here. If the answer isn't there, like, feel free to send it in the chat or send it to me directly. Aisling Quigley looks like Aisling. What marketing resources from us would you like the most? Interesting.
I've just shared the results. Yep.
Okay, thanks, Steph. The 41 out of 70 shared consent to contact. I guess if we all share, we all benefit. So what I'm trying to say is, it would be nice if we could work together on this, and you tell us, because you know what you need, and then I can kind of like devise a marketing strategy around that and get as many of the right type of people to you guys. So how can we do that? If we're going to get all these people to our site, then I'm going to be driving that amount of traffic. Sharing your studies, having your studies up there so that we can have the matches, that's going to be really beneficial. And it's also really nice that I can promote it and talk about it, and we've loads of different things coming down the line in phase 2 and 3, talking about different studies. Sharing your marketing materials wherever you can, if you have an office, any way that you can. Even sharing our website. If you have any new internal publications or newsletters or email campaigns, I'm happy to send you the 4 videos. You can share as much as you like. If there's something of interest and you want me to help work in a press release and do a little bit about publicity, and you're open to something like that, that would be great too. If you're wanting us to speak and just explain a little bit about how the platform works, privacy, funding, to create any sense of trust, or any questions around there, partnering for an event, if we ever get back to normal events and we have like marathons or anything, or like creating booths, anything that we can do around there. We don't have much of a social presence. It's not been a big thing of us in terms of like social media. It's not something we really focus on, but we will be looking at building that now, just because there's so many people there. And I guess a lot of you mentioned in your feedback that you use social media to recruit. So working together maybe and sharing the Reach platform that way would be really helpful too, sharing our live videos. So I've touched off a couple of things there. And then this, I think, is my last question. So how can we support you through recruitment? Like, what is it that you really want us to focus on next? Okay. So recruiting diverse populations is pretty high. Create more publicity in rural areas. Yeah, that's good. That's kind of what we were expecting, but it's still really good to know. So I've kind of sped my way through there, but we're at the like exciting part, I guess.
And lastly, we want to let you know that you can sign up for ReachBC today, sign up for a Reach Researcher account. If you want to learn more about any of the things we talked about today, please contact us at our email. Can you see it or not?
We can see it, but it seems to be very blurry. So I'm not sure. So I'll share our email addresses in the chat.
Okay.
We'll also be emailing everybody who signed up through your email address the digital toolkit, which will have all our information as well.
Great. Thank you everyone for attending the webinar today. It is recorded and we will be sharing the recording on one of our websites soon. So thank you again for attending, and please connect with us if you're interested in learning more. Thank you.
Thank you, everybody. Have a lovely evening.